What's going on, guys? What's going on? Welcome to a special broadcast of Urban Health Outreach Media. I am your host, Steve Belch. I'm telling you, we got a great show tonight. We got a great show. So if you know someone on dialysis, you have a parent on dialysis, loved one, tune in for this show because I'm telling you, it needs to be talked about. And I got some people here with me that's going to help me unpack this. Look, safe dialysis. What does it look like to you? All right. What does if you're on dialysis, what does safe dialysis look like to you? Now, let me give you before I bring on my guest, let me just tell you about some of the patients' complaints that you may hear globally, okay, from people that undergo kidney dialysis in center. Treatment shortened due to lateness, which may not be their fault, i.e. missed the bus, medical reason, treatment issues, fruit flies and gnats due to biofilming in the drains. People complained about that. Bed bugs, not properly being monitored, i.e. staff on cell phones, not an area where patients are at, being belittled or disrespected, staff not washing their hands, staff not responding to machine alarms in an appropriate time, patients who may have issues with post-bleeding moved to the side and another patient is put on machine. Safe dialysis, okay? According to the National Kidney Fund, there are over 2 million people worldwide currently receiving treatment with dialysis or kidney transplant to stay alive. So, listen, medical mistakes happen. We got to figure out how we're going to reduce it in the hemodialysis setting. So let me bring on my guest, my co-host tonight. You all know this guy. He's the host of the hit show Warrior's Quest. We lost him. So until he comes back, I'm going to bring on my special guest. She's a registered nurse. She's a kidney warrior. She lives in Chicago, Illinois. Without further ado, I'm going to bring on Christine Hernandez. Hey, Chris, what's going on?
Hi, Steve. How are you?
Pretty good. How you doing?
I'm okay, hanging in there.
You look comfortable.
I am.
Yeah. So let me bring on Jared. Let me introduce. He doesn't need an introduction. This guy is half of the Brown Brothers production, host of the hit show Warrior's Quest. Without further ado, Jared Brown, all the way from Hooper, Utah. What's going on, Jared?
Hi, Jared.
How we doing, everybody? Hi.
Pretty good. There you go. There you go. So let's get this started, man. I mean, safe dialysis. I want to start over with Christine. Can you just share a little bit about your story and how you just recently started dialysis, and just share with the people watching your type of access that you have that's not the average access?
I have access is called endovascular wavelength access. So it's a minimally invasive access. It's not done, with a surgical line. It's done like laparoscopically, and it reduces the risk for infections and post-operative complications. So that's why I did my research before doing it and decided to do it. This type of access, it also matures a lot faster. So instead of waiting 6 months for something to, for the fistula to mature, This takes like 4 weeks, so which is like amazing.
Wow,
Uh,
that is amazing.
What caused your kidney failure?
my kidney failure was a combination, I would say, of genetics and autoimmune condition.
Okay.
Um, I had no idea that I had kidney failure. My doctor would always tell me, "Oh, you're a little dehydrated. Drink water." And then my brothers both had started getting kidney failure, and I said, "Hey, doc, can I please get a referral to see a nephrologist?" She said, "You really don't need one." I said, "I need a referral because I just want to make sure my kidneys are okay because my brothers aren't okay. And I want to see how mine are doing." So I met this really wonderful nephrologist, and he was like a little skeptical and thought it was a little aggressive to go and do a kidney biopsy to check my kidneys to see really inside what was going on. But he took my whole, you know, care plan and history and significance to a board, and they approved it. And when he went inside my kidneys, I already had lost 60% of my function.
Wow.
So I had no idea.
Wow.
I was walking around not knowing I had 60% less function in my kidney, which was like pretty drastic, you know?
Wow.
And then it just declined really fast, my function. And as it started declining, I started doing my research on best practices, on what's the safest way for dialysis, because I knew I was going to need dialysis if I did get a transplant. Um, and I found this company that started doing these access in Germany. And I said, I'm wondering if
Okay.
they have it here. And I found out that they had it here. And I talked to my nephrologist, and he told me that they had an in-service, and there was one doctor here in Chicago that was really good, and he is starting, has started to do them, and that I could meet him, and that's how I started with my endovascular access. And he was wonderful, and really, I say he had hands of gold because you couldn't tell that I had
Hands of
anything
gold.
going
Awesome.
on. You know,
Now, Chris, how long have you been a registered nurse?
I've been a registered nurse, I would say going on 9 years now.
So, I mean, so removing yourself from your disease and just speaking from on a professional level, the title of this show is Safe Dialysis Care. Uh, do you know what does it look like? And we had talked off camera, and you had mentioned that you watch the shows from time to time, and that when you recently started dialysis, that everything that you heard from the shows kind of related to what you experienced at your in-center dialysis, and that you experienced some, I don't want to say improper care, but some issues with your access.
I
Can
when
you
I
talk about
when
that?
when I saw your episode on bleeding, that was one, and bleeding after your access. So I was having some trouble bleeding, and I wouldn't stop bleeding. It took maybe, like, the first time it was like 20 minutes to stop bleeding. And then the next time it was 2.5 hours. I'm talking every time we opened it, it would just squirt out, And I I my theory was that the needle was too big for the access, and that's why I was bleeding so much. And because I didn't know they had switched up the needles. So when I talked to my tech and to my nurse, I asked if something was changed because I didn't have the trouble and the problem with bleeding before, but now I'm bleeding and I can't stop bleeding. And it's like, that's deadly. So I want to know what's the difference. And then they had changed me from a 17 gauge long to a 15, which is way bigger. And that was the cause of my bleeding. Another
Wait a minute,
safety.
I'm sorry to interrupt. You saying that they changed your needle size from a 17 gauge, they jumped over the 16 gauge and went straight to the 15 gauge without even telling you.
Yes.
Jared, what do you think about that? I mean, you know, I know your sister-in-law experienced dialysis
Wow.
and you've been inside of a unit to see this stuff, but you hearing them. What do you think about this as an advocate?
That's just surprising.
Yeah, and I told them, I said, you know what? It's not your access, it's my access, and I'm protecting my access. So I'm not going bigger than a 17 with the longer needle until I know that it's safe and my fistula's grown big enough to be able to handle a 15 gauge or 16 gauge. But till then, let's do baby steps. You don't want to rush this.
Yo, absolutely. It'll create the hole much larger because of the increase of the diameter of the needles.
I mean, I was putting so much pressure on my access that my fingers were numb. I was 2 hours holding it, you know? And
at the dialysis unit, you was there for 2 hours.
Yeah.
They should have sent you to the ER maybe after an hour to get it stitched up.
And I asked, and they said no to stop bleeding. I said, well, at what point my hands are gonna give up? I can't keep on holding it this tight, you know.
Did they offer you a clamp?
No.
They may not use them, but they had these white clamps that they have because, you know, you have senior citizens that may have neuropathy because of diabetes or whatever's going on and can't hold their needle sites. And so we put a clamp on them and that applies the pressure.
I've heard of the clamps, but I have never seen one. Another time, I have my blood clots, you know, like it clots, especially when the machine stops. So my machine had broke during my dialysis. So when it stopped, my tech disconnected the dialysis, the tubing, put it together so I could try to run it. But my needles, along with the little extensions, were left like basically open to air with no flush. So me knowing if you're not going to flush and cover this, A, I'm at risk for infection, B, it's going to clot. Because when the blood touches air, it clots. And then when they try to hook me up again, guess what? I had infiltrated, it clotted. I said, take me off of this machine.
Sure.
You know?
All right. Now, I want to piggyback off of that because you just led me into, I want to read a paragraph from the Canadian Journal of Kidney Health and Disease. And this particular article is development of a hemodialysis safety checklist using a structured panel process. But in this article, it says, now we're in 2014. This article is from 2015, but it says a 2006 survey documented provider and patient opinions on safety in the HD unit. Frequent problems included greater than 2 vascular access needle insertion attempts, That's 30% of people who were surveyed. Access clotting, 20%. Machine difficulties leading to early treatment stoppage, 15%. And then failure to record pre-dialysis blood pressure or weight, 13%. What else? And access needle disconnection, 5%. Almost half, 49% of the patients who responded indicated that they are sometimes or always worried that a mistake will occur during their hemodialysis treatment. How many people watching this broadcast feel like that, always worried, or maybe sometimes that a mistake will occur during hemodialysis treatment? Chris, do you, before you go to dialysis, do you feel that way?
I do, but I have like a really big mouth, so I advocate for myself a lot. So I go straight to the scale. I weigh myself. I grab my mask.
That's good though.
And then
No, but what I'm saying, before you go to dialysis, have you ever thought or maybe worried that a mistake may occur during treatment?
I'm afraid that I'm gonna die. You know, I'm afraid that I won't come out of there alive sometimes because of a human error, you know? And it's scary to feel like that, but I do feel like that. I'm like, my life is in their hands, you know? So they have to take you know, their position and their title and really, really seriously, because it's basically we're at the mercy of them.
Mm-hmm. And Jared, part of this article, it starts off, it says errors during in-center hemodialysis are common, and patients often worry that an error will occur during their hemodialysis sessions. Checklists are a useful patient safety strategy that have improved care across a number of medical disciplines. The thing is that there's no standard checklist. I mean, it's on the hemodialysis sheet or the computer, whatever they use, and they may have a checklist like, did you check the temperature? Did you check the valve? Did you check the dialyzer? Is this the right patient?
Right.
You know, that's they may do it that way, but they don't actually, what I experienced, involve the person in that process. And do you get involved in that process of like a checklist, maybe, say for instance, does the nurse or the people who come around and do the assessment may say, ask you any recent illnesses or ask you if you got any new medication or any weight changes, anything out of the way to try to see if you had any changes in your care?
They asked me about if I feel sick, if I've been dizzy, if I've been nauseous. But a big thing I have is with weight, because I feel like sometimes they like to pull a lot of the, you know, fluid out, and sometimes you pull too much fluid, you become hypovolemic. And one time I went in there and I was weighing like 124 pounds. I came out weighing 113. And I felt dizzy and nauseous. And I had to, at first it took me a while to leave because I wasn't feeling good. Then took me a while to be able to get my thoughts together. And I told my doctor, okay, so what's my dry weight? I want to know my dry weight, because if I eat a lot, I'm going to gain weight. It's not water weight. Okay. So I know when I got water weight because I'll be swollen. If I'm not swollen and I'm gaining weight, it's because I'm eating more. So you guys got to be a little more conscious of when I'm eating, if I'm gaining weight, not to want to pull everything back that I gain back, you know, because I'm trying to gain weight to be healthy. And so they've adjusted my dry weight so they don't pull anything off unless I tell them that I'm swollen or I'm short of breath, or if I have symptoms that I did retain water, and then I'm like, okay, you could take some out. But I don't think a lot of people know that, or know that they could do that and talk to their doctors about that, you know?
Right. So let's talk about safe dialysis care and some of the complaints that I mentioned in the beginning of this broadcast. And Jared, please chime in if you
Sure.
heard or any of your guests may have discussed with you who may still be looking for kidney undergoing in-center hemodialysis. They may have mentioned some of these complaints. Now, and I know you just started treatment at this new facility. I'm not sure how long you've been there, but sitting in the patient lobby, and a lot of times, you know, patients do talk among themselves about what's going on in the unit, what they don't like, what they do like, what technicians are good, who aren't good. But have you ever heard anyone or seen anyone, or if anyone is watching this broadcast, please comment. We got to stand in front of this and talk about it so we can come up with solutions and ways to make sure people who undergo kidney dialysis in center know what's going on, even their families. But Chris, have you seen or anyone mentioned to you their treatment being shortened due to being late?
I heard one time one girl arguing with the doctor and the nurse, and they were like, well, you were late. And I didn't understand what they were talking about, but she wasn't happy. And they said, you got to start coming on time. It's not our problem that you come when you come, you know? And I didn't know what it was
Mhm.
about. But then the last time that I was there, my kids were outside, and that young lady happened to walk in, and she says to the tech, you know, I want my full treatment. She says, well, like you dish out what you get, like really really rude to her.
Oh,
And
wow. That is
it's so,
so.
you know, very very sad, you know. And
That is
Mhm.
sad.
I was sad that my kids heard that, because they were worried, you know. They were like, mom, are you treated like that? I said, no, not me, because you know, I ask a lot of questions. I'm there on time. I don't have problems with anyone
Mhm.
there. So I'm okay, you know. And
Absolutely.
I have a really good I have two really good techs that got the handle of accessing my fistula. They started me on heparin, no more clotting for me. So
Oh,
that's
Right.
awesome.
That's good. That's
Awesome.
good.
which is really good. And then when you have a whole treatment, you feel so much better. Because the day that I clotted, I was on an hour and 15 minutes. They took me off because they couldn't do it anymore, right? I was
Mhm.
already stuck like 4 times. So
Whoa, whoa,
I
whoa, whoa, whoa. How many times were you stuck?
four.
Now, if anyone's watching this
What?
broadcast, please make
Four?
a comment. If you've been stuck more than 2 times, more than 3 times. Now,
Yeah.
no, Jared, I've actually worked in places where patients been stuck up to 6 times. Okay, so
Wow.
4 times is nothing, but it's more than enough.
Yeah.
And that's why in that article, people complain being repeatedly stuck more than 2 times in the access. And that's how you can damage the access.
Right. Right.
Is that correct, Christine?
Yeah, I came. I said that was it. I said, take me off, because first of all, it's clotted. I'm not gonna get. It's not another insertion point you could go to. So let this heal. I put my ice and my warm on it. I took care of it, and then but I was not feeling good. And I called my doctor and I told him kind of what was going on. And he was kind of irritated a little bit, and he told me, "Oh, go to the ER so they could do." I'm like, "Why am I going to go to the ER when I could go tomorrow to the center and do it?" Well, tomorrow's not your day, but why can't I go tomorrow? You know, the ER is going to be a lot more expensive versus going to the dialysis center.
And Chris, if I may interject, the only time we would send a person to the ER if their potassium was up, but we normally, if they have issues, bring you back the next day to resume your treatment.
I had to wait 2 extra days, you know. Well, actually 3 extra days because that was during the holiday. So, you know, when the holidays happen, things change. You know what I mean?
Right.
And I hope I never have to go through that again because I felt very sick, you know, and I felt like I didn't get the treatment I needed. My blood wasn't clean and I felt terrible, you know. And I think everyone should get their full amount, you know, of time that they're supposed to get, you know, for their own safety.
Now, let me ask you this. Have you heard or seen, since you've been at your unit, fruit flies or gnats flying around?
Oh, no, I haven't.
Yeah, I mean, in some DaVita units, this is common during the summer times where because of the drains, Jared, where the waste comes and go out the drains, it kind of builds up over time.
Okay.
Time, like a biofilm.
Oh my goodness.
Okay.
Huh?
All right.
No, what did you say, Chris?
I said there's actual fruit flies. That's like really.
Yeah, absolutely.
Right. They're small little things. The fruit flies are really small, but nonetheless.
Could I ask you a question, Steve?
Sure.
When I know that as you know, when we're changing beds for patients and there's a patient coming, we disinfect the whole room with the sandy wipes and clean it for the next patient. Are they supposed to do that at the centers with the chairs and everything?
Oh, absolutely. A matter of fact, I'm glad you said that because I have this checklist of dialysis station routine disinfectant. And before, so this is from the CDC, and it has a part A and part B. And so routine disinfection of the dialysis station after patient has left the station. So the person is supposed to wear gloves, apply disinfectant to all surfaces in the dialysis station. The dialysis station consists of the machine and the chairs, everything within that vicinity. Using a wipe emulsion with friction, but they're supposed to use a bleach solution that's properly mixed with the concentration. Then they're supposed to ensure surfaces are visibly wet with disinfectant to allow this to dry. The surfaces have to dry. Disinfect all surfaces of the empty priming bucket. Allow the bucket to air dry before reconnection or reuse. Keep used or potentially contaminated items away from the disinfected surfaces. Remove gloves. Perform hand hygiene. And then it says, do not bring patient or clean supplies to station until these steps have been completed. Now, this is just recommendations from CDC. Now, they're feds, and you would expect facilities to adhere by this, but given the nature of dialysis and the environment and how they bring people in, take them off, you barely would see this happening in this in this format. And even right here, part A, before beginning routine disinfection of the dialysis station, meaning before they start cleaning it, they're supposed to disconnect and take down used blood tubing and dialyzer from the dialysis machine. discard tubing and dialyzers in a leak-proof container. Check that there is no visible soil or blood on surfaces. Ensure that the priming bucket has been emptied. Ensure that the patient has left the dialysis station. Discard all single-use supplies. Move any reusable supplies to an area where they will be cleaned and disinfected before being stored or returned to a dialysis station. Remove gloves and perform hand hygiene. So, to answer your question about cleaning the chairs, they're supposed to do that with a bleach solution and let it air dry before you call you back. But what happens is they do that and they bring the patient back and they sit in the chair and it stains their clothing because it hasn't dried and the bleach is still wet. And you know how bleach turns colors on color clothing.
Right.
This happens too, and it's not talked about. So what about bed bugs? Have you heard of that in your unit, Chris?
I haven't heard of that in my unit. I haven't heard.
Any of your guests talked about that?
I've not had any of the guests talk about bed bugs, but I have heard of guests. They've mentioned that they've been stuck multiple times and they've had issues with, getting stuck in the right way. That's been a common issue, unfortunately.
Right. So, Chris, what about this one? Not properly being monitored. Staff on cell phones or not in the area. Have you experienced that during your treatment time? I know you said your technician is experienced, 30+ year veteran, so I'm sure she's not going to do anything like that, but to err is human. So
right.
Have you experienced, if you may say, anything like that during your time or felt that way, that you weren't being monitored?
When I first started, before they changed me to my expert, I call her my angel. I have 2 angels there, and they are the best. But I was being left alone. The machine was ringing, and I'm like, oh my God, I can't see it. So I can't see the numbers. I can't see the pressures. I can't look at it. So I'm like trying to take pictures with my phone, selfies of the machine, so I could see the number and see what's going on, because I didn't know what was happening. So right now, I tell you the truth, I feel really relieved with the 2 girls that I have. They're really good. They make sure that my access, not only once they stick me, that it's secured. They tape it on for me. They tape it to where they could actually see it just in case it leaks, And I call it the butterfly, so they cross it over, And I haven't had a problem since, but I was being left alone with the machines ringing, and I'm like looking, I'm like, anybody? Anybody? This is ringing. It's like, okay, And then one time I had to tell the other tech that my access was like swelling up to turn it off. So they turned off the machine and I stopped it.
And so if anybody's watching this show, please comment. Jared, this is kind of common what Chris is talking about.
It is, yeah.
And you see this in Facebook groups talking about it, but no one is coming on live and talking about it so we could try to come up with a solution, or if not a solution, but education to let people know this occurs. So if it does, what to do to prevent it again, and what to be on the lookout for to prevent it from happening. What do you think?
Absolutely. Yeah, like when I was reading information for tonight's show, the website that I read tonight, it reads right here that let me read this really carefully so I don't get it wrong, but it says right here that the high reliability organizations are supposed to establish and maintain a culture of safety in which all staff members are encouraged to report errors or potentially harmful events in a blame-free environment without fear of punishment. And at the same time, a safe organizational culture does require appropriate accountability. So my question
Absolutely.
is that sort of environment really being created?
Not all the time, because when someone gets infiltrated, say for instance, you're supposed to do an incident report. And I know plenty of people who have not done incident reports, and they're their in-house incident reports with the VITA they call adverse reactions, or AOR, adverse occurrence report. And I mean, it's so much stuff that I don't have the list right now, but it's so much stuff that falls under that happens. Like if somebody falls or this happens, it's so much stuff that a lot of the caregivers don't report it because it takes so much long. If you worked a 14, 13-hour day, and you did an infiltration or first shift, second shift, you had someone's machine, the blood clot, and you had to throw that away. That's an adverse AOR report. And then something happened third shift, but you don't have time to do this because you're changing people on, taking people off. So at the end of the day, when third shift has gone, 13 hours later, if you're not really thorough and write what happened during that time, I'm gonna just be honest. Who wants to? This is the mindset, man. Yeah. Who's going to sit down after 13 hours, mentally and physically drained, is going to want to do 2 incident reports? I mean, they want to hurry up and get out, especially if they got to come back to work the next morning at 5:30. Say that again, Chris.
I said the next morning they're coming right back to it, and it's draining for them too, like for the techs and the nurses. So it's like a endless cycle for them, and there's a lot of burnout there in the unit and stress, and I feel bad for them, especially, I mean, I'm a patient, I'm a warrior, but I'm also a nurse, and I have compassion, and I know I see what they go through, and I'm like, wow, this is like a race for them, and they have to be careful.
And a race which can possibly cause an error.
Right.
Yes. I mean, I look at my tubing. I'm like, okay, is there like a clot coming up there? Or like, I'm always very vigilant. But then I look at people, I look around and people actually fall asleep. I don't know how they could fall asleep. Because if you fall asleep, you could bleed to death.
You're right.
Yeah. How can you not be paying attention?
I mean, with some people, they just can't help it.
Yeah.
I mean, because of other conditions or medication they may be on, some elderly. That's just the nature of the disease. But for most people who are awake, maybe watching television or online, cell phone, but even while you're occupied with that, you still have to be vigilant, right, Chris?
Yes, very vigilant.
Regardless of, saying that the staff has got it, you're going to leave it in their hands. But again, they're human, and to err is human. Matter of fact, in the article that I mentioned, it says, if I may read, it says, the To Err is Human report published by the Institute of Medicine. Now, again, this is back in 2015, estimated that 98,000 patients die each year from preventable medical errors in the United States. Similar rates preventable adverse events have been reported in Canada, Australia, New Zealand, and England. Now check this out, Jared. The key lesson from these studies is that errors are usually a result of the system of care rather than the individual.
Okay.
Then it goes on to say, Chris, patients with end-stage renal disease, ESRD, are at high risk for medical errors given their frequency of complex treatment, comorbidities, polypharmacy, physiological consequences of ESRD, and coordination with other hospital departments to provide care. These factors all contribute to a stressful and busy hemodialysis unit. Do you think that?
I think I do think that. I think that doctors need to talk to each other, and I'm lucky that my doctors do talk to each other and collaborate with each other. And I finally got my doctor to speak to my hematologist, and now there's a plan of care for the heparin, and that it's safe for me. Because before I couldn't get them to talk to each other, and I'm like, all you have to do is talk to each other for my safety. I mean, please talk to each other, because I was showing them each other's emails, just so they could see what they were talking about, because they couldn't pick up the phone. But now we got it all together. But there's a lot of errors happen because of some nurses are afraid to ask questions because they're going to be yelled at. Techs are gonna don't want to ask questions because the nurses are gonna yell at them. So it's like a big circle of like not wanting to communicate because you really don't want to deal with like the BS, And but when you got other people's lives in your hands, you really, really have to be that person's advocate and not care what they're gonna tell you. Say, hey, it's too bad. This is what this person needs, and that's it.
Right. No, I was just going to say, if you're watching this broadcast and you go to outpatient hemodialysis at an in-center, DaVita, Fresenius, what's that other one? Oh my God. Jesus, I can't even think of it. RPI, RCI, I can't think of it, but it was one more on the tip of my tongue. But anyway, if you go to these centers and you experience what we're talking about, please comment. If you experience this stuff, or if you've been through any type of trauma or experience any type of adverse reactions on dialysis as a result of human error. Okay. Now, one more thing I wanted to read from this article was, it says subsequent studies have yielded further insight into the unique HD safety issues. A review of 526 hemodialysis incident reports to the Pennsylvania Patient Safety Authority over a 12-month period identified medication errors, 29%, protocol violations. These are protocols that the company that you got to do, Jared. Like, it's a procedure to put the needle in. It's a procedure to hook up and turn the blood pump on at a certain rate. It's a procedure for everything in dialysis. So you had protocol violations, 12.9%, and falls, because patients do fall in units because when they stand up, their blood pressure may bottom out because of orthostatic hypotension. All right. That's 5.9%. And then it says, as common errors during HD treatment. These are common errors. All right. Medication errors, protocol violations, and falls. Okay. I mean, we got to talk about this because
Absolutely.
it's not being talked about in the kidney dialysis community. I mean, it's talked about maybe in the groups, but if you're not in those groups, how are you going to know about it?
Right.
You know what I'm saying, Chris?
Yeah, and then knowing how some some people, they do drive themselves back and forth to from the dialysis center home, being educated on waiting for like hemodynamic stability. So wait, sit there a minute, a while to make sure you're safe, to feel that you're safe enough to drive, not to kind of rush out and you could
Good
just pass
suggestion.
out and crash your car and hurt some people. So like a lot of education needs to be continually happening for a lot of patients, and then patients also need to speak up for themselves.
Absolutely. Absolutely. Now, I'm going to just read off. I mean, it's a lot. See, a lot of people don't understand the magnitude of the safety. That's why we preach this with Warriors Quest or the health education special broadcast. But these are, and there's no standard checklist. And so I just want to let people know who go to dialysis. It's not like the techs or the nurses standing around and taking this in consideration. Like I said, there's a small checklist on the flow sheet. But when I read this list, Jared and Chris, I mean, just think of the magnitude of what needs to be checked out. Patient identification, pre-dialysis weight, allergy check, doctor's orders noted and transcribed, medication correctly administered, treatment plan reviewed with patient, patient asked about health concerns, hand washing, pre-dialysis blood pressure, easy cannulation, correct needle insertion, pain-free cannulation, secure dialysis needle, correct dialyzer, correct dialysis solution, correct machine setting, no circuit clotting, blood pump speed at the prescribed rate, blood samples collected, blood specimens correctly labeled. Now, with blood specimens correctly labeled, sometimes you can mistakenly put someone else's name on another patient's label if you're not paying attention. Dialysis treatment for complete duration, no blood loss, blood clotting after dialysis, no evidence of access infection, post-dialysis blood pressure, post-dialysis weight, no patient falls, no needle stick injuries, medical errors reported if witnessed, management support for incident reporting, adherence to procedures. That's a lot, man. That is a lot. There's a lot of people who start dialysis who, have no medical knowledge. I mean, of course, I'm sorry, Christine is a nurse, so of course she's going to apply her training where she worked with peds because she knows that, be it this is sent it to dialysis, but you have a checklist and what she was doing, time out or whatever the case. So she's going to be more responsive and I'm pretty much abreast on this. But Jared, what about the average person, Chris?
Right.
The average person want to know to think about this.
No.
I always tell my patients, have your own checklist. Write your checklist and have them answer your questions because they have to answer your questions. They have to, and that's your right as a patient to get your questions answered. And if you feel something's not right, ask, why is this happening? Because if you don't ask, no one else is going to ask for you. You have to be your own advocate.
Let me read this comment from one of our consultants to Urban Health Outreach Media, Dawn P. Mormon. She says, most patients, and she's a 28-year kidney patient. She says most patients have been the victim of some form of neglect or error during treatment. The problem is a lot of patients don't feel empowered enough to speak up or don't even notice that an error has taken place, which she is absolutely true. A lot of people do not notice that an error has taken place. That is like 95% of the time. Patients should pay attention to everything that takes place during treatment, even if you love your nurse or tech. Be sure they are following procedure, not just for you, but the other patients around you. Very well spoken, Jared. Very well spoken.
Well said. Very well said.
What do you think about that, Christine?
I agree. I agree that some patients have been neglected, and for instance, there was this older lady the other day. She was maybe like a few chairs away from me, and I'm looking at her. I'm here at my dialysis.
Oops.
I look around. It's something that I can't help but do, and I notice she's touching her left arm, and she's like, warm, warm. But that's the only word that's coming out. And I said, hey, there's something wrong with her. You know, something's going on with her. And she did have something going on with her. But no one was noticing that she was touching her arm and saying warm, warm, warm. You know, which is really sad because everyone's so busy and running around, you don't get that chance. But there's a lot of errors that could happen because we're human, you know. Now it's eliminating those errors and having checklists to have a safety checklist and to adhere to the safety checklist.
Absolutely.
It's very important.
And one thing you mentioned, you said people running around. Now, Jared, there is a site, I can't think of the name. I want to say Dialysis Patient Safety, but the site that the lady Barbara Grant that originally got the dialysis, how does dialysis safe care looks like. On this site, she shared a story, and I've seen this many times, Jared.
Okay.
Where, as Ann said, technicians, if they understaffed, running around attending to other patients, but she told the story where with a lot of warriors, Jared, may have diabetes, and as a result of diabetes, may have gastrophoresis. And one of the symptoms for gastrophoresis is diarrhea. So with some people, they get on dialysis, they may have to go to the bathroom because of this. And they raise their hand or call for someone to try to take them off so they can go to the restroom. Well, she shared this story where she had to go and she tried to get someone's attention to go, to take her off so she could go, and it didn't happen. And she ended up soiled in her chair, and she had to cover herself with the blanket to prevent the smell from, going into the unit. But, she, with dialysis, you got a person, depending on where you sit at, if you're not sitting at the end of the loop, if you're kind of sitting in the middle, or not at the end, you're going to have someone sitting on both sides of you. And, of course, you'll be able to smell that at some point. And I've witnessed this many times, not witnessed someone raising their hand and we didn't get to them in time, but maybe someone that may have happened and they didn't call, or they thought maybe they could have held it and it didn't happen. But this lady shared a story that this happened to her. And there's a lot of people on dialysis, and I'm sure that it's happened to people, and it's as embarrassing it can be. it does happen, and these are just one of the symptoms and side effects of this ugly disease, diabetes and kidney disease. Have you seen that, Ann, or someone ever mentioned that of maybe having a experience like that on dialysis?
No, my brother did um, experience someone in front of him fainting, and they started doing CPR on him. He coded at his center in New York City. So he's seen that, and he got really scared because he says, that's a reality. Sure. It happened to any of us.
Yeah.
Mm-hmm.
And then I told him always take like a little snack with him and some food to eat. That way, as he's dialyzing, he has some kind of nutrition going in, so he's not on empty stomach and make him feel worse or sick or dizzy. So, because sometimes your sugar goes low. So, just always have something that you could snack on and to prevent yourself from feeling sick, And if you're feeling sick, raise your hand, let them know, or scream if no one's paying attention to you, and get somebody's attention, because you don't want to be there and then end up passing out and just not, ending up coding or something like that.
Oh, absolutely. I'd like to just take a moment to acknowledge half of the Browns brother production team, Jeffrey A. Brown, all the way from Abu Dhabi, Saudi Arabia. And before I just make a comment on his post, I just want to wish him a safe passage if he's there, him and his family, with the current crisis going on. You're definitely in my prayers, you and your family. Jeff says, great insight for Chris Ann, a kidney warrior and RN. So we just definitely want to get this message out there, and you're definitely sharing a lot of great insight, Chris.
Absolutely.
Tonight. So we appreciate you taking the time out of your schedule and coming on the show and sharing your story and insight on this serious topic of safe care dialysis. What does it look like? Because there's a lot. I mean, there's really a lot that we could talk about of people's experience. Even Don Mormon mentions, Jared, we patients have the ability to observe the entire treatment area. We can see another patient in distress before the staff does. That's why I suggest staying awake during treatment if possible. I mean, what more insight from someone who does dialysis at home?
At home,
At home, done it in the treatment, and that's the reason why she went home, because of these things that occur in the treatment facility, and she's gained the insight to watch this while she was undergoing in-center dialysis. As much as she doesn't like it, she had to do it for a period of time. Now she's in the comfort of her own home. And we got to get home, man.
That's
I always enjoy interacting with Christine. She's, she just lights up the room. She's a great smile, and she just has a great aura, and I'm, what you said tonight is just invaluable. And I think it can be insightful, and it can give, it can be very beneficial to a lot of kidney warriors. And so it's been great to hear you speak tonight.
Oh, thank you for having me, guys. And I hope to talk to you soon again, okay?
All right, okay. Well, me and Jared, it seems like you're getting tired, but we're going to let you go, and me and Jared are going to continue this. But thanks for sharing your story with us, Chris.
All right, take care.
Have a good night.
3 o'clock in the morning.
Bye-bye. All right, bye-bye. So, Jared, let's continue this. You got time?
Yeah, sure.
But Jared, as we heard Chris' story, and as you heard the multiple problems that could occur because of human error. Did you realize before being a kidney disease advocate that your sister-in-law was at risk for this?
Not to that extent, no. And that's not only with my sister-in-law, but also, interviewing other kidney warriors with Warriors Quest. It's really been to understand, the significance, or as you put it, Steve, the magnitude of the care that's being done on, at a dialysis center, because ultimately, I mean, it doesn't happen often, and it's extremely uncommon. But ultimately, someone could die from the care, because this is dialysis is a life support for this kidney warrior. And if and a lot of the information that I've read and been given, it's not the machines. Now there's, if the machines aren't updated, and if the machines aren't repaired, if there's anything wrong, then sure, that can be a concern. But most of the information that I've been given and I've read recently, most of the problems aren't machine related. So it's not necessarily that the machine has made an error. It's that the person who's running the machine has made an error. And so again, I want to kind of piggyback on what you said, Steve, is that, they're in whatever unit they may be in, the technician, God bless them. And by the grace of God, I hope that they can do great care, and that they can have the environment that we're now talking about, where if something isn't done right, that maybe they can provide some sort of information, and put down that information that there's an error.
Oh, absolutely.
That to be put down, properly. But, and so that they don't have that fear of, losing their job, or fear of being, punished, and that they can report adequately. But but the more we talk about it, the more we discuss it. There are so many different. I hope, sure if it's because I'm sure because we're on a little bit late tonight, but I hope that we get more comments, and that we get more feedback from other kidney disease warriors out there, and that we hear from them and get their side of the story as well. Because I know that, I know there are other people out there that have their own experiences, and I'd love to hear about them in the comments from this broadcast.
Oh, absolutely, Jed. And last year we did a survey. All right, and this is what the question was: if you are receiving kidney dialysis, have you or a family member on dialysis needed someone else to help you while getting treatment because the center was understaffed? 52% of people answered yes, 48% answered no. So, I mean, little, not too far off, almost half and half, but
Right.
52% of people needed, or their family needed someone else to help getting treatment because the center was understaffed.
Right. Wow. That's very disappointing. Very disappointing.
Oh my God. I mean, so again, guys, like Jared said, see, let me just say this, because Jared, he's not a nurse or a technician, so he's not going to say everything, or try to delve into the rabbit hole of asking people to share. But like he said, if you experience any of these symptoms, but let me just put it like this: if you bled out after dialysis, where you thought maybe they told you was finished bleeding, and you stood up and blood, and you felt something warm in your arm after you put your coat on or your shirt, and you go out to the lobby and you come to find out that you're still bleeding, we need you to post and say something. Or if you stood up and your technician nurse walked away and you passed out or fell back in the chair because no one was there beside you when you stood up, we need you to post. Or what about if your blood clotted in the system and they unhooked the needle, they unhooked the line between the needle and they poured out a long string of clot and said your system was clotted and they had to discontinue treatment and throw away your whole system and your blood. If that happened to you, please post and let us know so we can talk about this and see how we can prevent this stuff from happening to you again. What if you came in late and you're supposed to get 3.5 hour treatment, but they cut your time to 3 hours because they said you was late and that was no fault of your own. What else? What if you cramped and no one's around to help relieve those cramping symptoms because they was gone to lunch or break or someone was on their phone? We need you to respond. Tell us, talk. This is how we educate the kidney disease community, especially with new people who may start and may not know anything about this or their family members. We need you to share this post, watch these programs, interject, share your information, because we may be able to help you prevent something else from occurring. I'm a lay person, 33 years experience in the dialysis field. Tamika Moore, 20 years. Jared A. Brown, have dual of the Brown Brothers production, 3 years or more dealing with sister-in-law with kidney disease, plus family members. His dad had kidney cancer, neighbors had kidneys, done dedicated part of his life to help other people who are searching for a kidney donor. And his brother and himself, the Brown Brothers production, have assisted several warriors in getting transplants. So this is very important for people to share and to be a part of this, these broadcasts, because you never know what can occur from this. What do you say, Jared?
Oh, absolutely. The power of share is just ridiculously important. Honestly, is that we're all connected. It's amazing how you find somebody that you know on Facebook, and then all of a sudden they become your Facebook friend, and you're looking through their Facebook friends, and all of a sudden you see that you have like maybe 30 or 40, 50 mutual friends, and it just happens. And so because we're all connected, okay, the power of share, it can actually lead to success. And just like you said, that's part of the success that my brother Jeff and I have had, is that because we've had people share the post from the Facebook pages that we manage, that's exactly how we've been able to help these kidney warriors that we advocate for, is because people are sharing. And it is so important, especially with education. Man, if this has to do with somebody's, I don't know, their heparin infusion, or maybe inadequate handoff of information about patients' medication, whatever it might be, okay, this information that happens needs to be shared, so that if a kidney disease warrior is having treatment tomorrow, if they watch this broadcast tonight and they get updated on this information, then they're more prepared tomorrow. That's how important it is.
They can apply this information tomorrow when they go to treatment. Oh, absolutely. Hey, Jared, so as I mentioned about post-bleeding, Jeremy Paraco, he said, I had reached home to find myself still bleeding. Then he goes back to ask the question, how often are the machines calibrated? Normally it's quarterly. They do the PMs. My BP has to be taken 5 or 6 times for an acceptable reading. Absolutely. Chris Ann responds back to Jeremy. You can tell them not to pull out too much. Ask to talk to your doctor, and that's because he had mentioned about them pulling off too much fluid. And then we go to Don P. Moorman, consultant and kidney disease advocate, and also CEO of New York State's CKD Champions.
Right.
Lots of patients don't complain if their treatment is shortened because they don't realize how harmful it can be to them. They're happy to get off early. I used to feel that way until I learned better.
Right.
Dawn, you are absolutely right.
Awesome. That is awesome.
That when I worked in dialysis, patients want to come off early. Some patients get off for little small stuff, Jared. If they mad or something, or it could be anything. Somebody just say, "Take me off," and you try to explain to them, they don't want to hear it. And then when you come with the, it's a form, Jared, that these facilities have called AMA, Against Medical Advice.
Okay.
And on these AMA, it says I, and then it has a blank where the person fills in their name. You're pretty much acknowledging that you could be at risk for certain adverse symptoms or problems as a result of you discontinuing your treatment early. So if where I worked at, if it was 15 minutes or less, we didn't have them signed. But if it was more than 15 minutes, we had them signed. So for instance, if a person, we had an issue with someone's access, say for instance, like Chris, and she said she had issues with her access. And so say the fourth time someone came and they was able to get it to run halfway decent. And so say if her blood flow rate was 300 and we had to run it at 200, okay? And you go through the treatment and say the machine keeps alarming because the arterial pressure drops, because that means that our arterial pressure drops, is not getting a good flow through that needle.
Mm-hmm.
So if that happens, the machine keeps stopping, say maybe a half an hour before the patient's supposed to come off, say the blood clotted, or say 45 minutes, the blood clotted. So that's still enough time to resume the treatment, set up a new system and restart treatment for that last 45 minutes. Some people don't want to do that. They just like, take me off. That's okay. We didn't have problems. Thus, you didn't get a good treatment because one, you didn't run at the proper blood flow rate. Two, the reduced blood flow rate, you ain't going to get that clearance. All right. And three, your system clotted. You lost blood.
Mm-hmm.
You lost blood.
Yeah.
That blood is not going back to you, especially if the system clotted. So, and Dawn says, she says, getting off treatment early doesn't hurt staff, it hurts you. I had no idea a dialysis treatment only cleans 15% of your blood. And that means, look, the kidneys work 24/7. That's why you need more treatment. Okay. It's already bad enough that if one person runs 3 hours at 3 times a week, that's only 9 hours of treatment, Jared, compared to your kidneys working 24/7 cleaning your blood. A person's only getting 9 hours of cleaning. Yeah. That's why this is so important. Why I'm so passionate about safe care, dialysis, safe care, what it looks like, and having people and their family members who take their family members to dialysis, what to look out for and not just go there, drop them off, and leave everything to the staff. Or if you're on dialysis, go there and just sit there and just wait and let the staff do what they do. Plug in your earphones and turn on the TV and watch Wheel of Fortune or Let's Make a Deal. Let me tell you, Wheel of Fortune, all right, is one of the many shows you will see a lot of people watching in the units. I saw making my rounds, because I see the TV they're watching. Wheel of Fortune, Let's Make a Deal, Maury, Jerry Springer, Steve Wilkos, and if it's in the evening time, it's Wheel of Fortune. No, what's that one in the morning with?
The Price is Right.
Price is Right. Price is Right.
Yeah,
that's what I meant to say. In the morning is Price is Right, but in the evening is Wheel of Fortune, TMZ. What else? Maybe some cooking shows, and what else? But on the weekends, a lot of the older patients are watching Westerns, okay? Western shows on Saturdays. But the point of saying all that was a lot of people are preoccupied, and it's okay. But you can't forget about the importance of your treatment, as Don mentioned. You got to know what's going on. If not for yourself, for someone else who can't know for themselves. Because someone could take their mom to dialysis and their mom can't speak because of a stroke or something's going on. And they the person's taking their loved one to dialysis may be thinking, because they laughing and they, everything, this and that. That doesn't, just because that happened doesn't mean they're going to look after your loved one, like sit there in front of the machine the whole 3 hours or 3.5, 4 hours and make sure nothing happens. No, because they got 2 other or 3 other people to watch. So they may not take that person's pressure for an hour or 2. I've seen patients, because I was a charge nurse and I had to go and check behind people, I seen people who didn't document up to 2 and 3 hours. No information in the system, like blood pressure, how much fluid was poured off at this certain time. They had to go back. The blood pressure took automatically. They can get that off the machine, but a lot of times, like what the venous pressure was or what the arterial pressure was at 7:30 and how much fluid was taken off at 7:30. And then you go to 8 o'clock, it tells you how much. They go back and pretty much falsify or kind of estimate.
Right, guess, yeah.
Right, guesstimate. And so I say all that to say, please, guys, watch what's going on, like Don P. Mormon Edwards says, especially if you're in center. It is very critical. I mean, it could be life or death, Jared. Jared, we had a gentleman on, you may have seen him post, Donnell Carley.
Right,
He's
yeah.
out of Thomasville, Georgia. 3-time transplant recipient.
Yeah.
All right. Now, he was unfortunate to be on the end of a air embolism. Air embolism, Jared, is when air is introduced into the circuit and it gets to the patient and the patient suffer adverse reactions.
With after they've been cannulated, right?
Huh?
This is after they've been cannulated?
Well, yeah, this can happen. Like if you got the needles and there's somebody giving you saline, because you're cramping and they walk away or not paying attention and the bag runs dry.
Oh, okay.
In that way, and if the line is not in blood detector, the air detector clamp. So when that happens, it could clamp off. Any matter of ways it can happen, okay? But it happened to him, and they tried to send him home, or they did send him home, and he experienced a mini stroke.
Wow.
So this is why this is important. And when this happens, if you're in the unit and if you experience a air embolism, you're supposed to turn the person on their left side and put them in Trendelenburg. And Jared, Trendelenburg is a position in the chair where it places the patient back in the position that sits them back where their head is lower than their feet. Their feet is raised up, their head is lowered back, and they're turned to the left side.
All right.
You do that if you experience a air detector. And Don P goes back. She mentions safe dialysis requires the entire team following protocol and procedures, including the patient.
Right.
We do our part to be sure we stay safe by educating ourselves on what to look for in the unit. Man, she's been hitting all of.
She's been on point. Yeah.
She's been on point, Don. Yeah. Thank you for adding substance to this topic. You've been on point with everything you have mentioned. And then she goes on to say, there's a false sense of security about being taken care of by professionals. We have to take responsibility as patients to stay safe. My God, Jared, I mean, she just hit it out the park with these.
Right. She has great comments. Yeah.
Very relevant to what we're talking about.
Very relevant. Yeah. I mean, they're right in line with what you're talking about, and they're exactly what patients need to hear right now. I mean, it's a teamwork, and she hit it right. She said it exactly right, because, if you're not self-advocating, then you're not going to be aware of what the technician's doing. And then it's partially your fault then, partially that if you're not taking notice of what the technician's doing, or if you don't know whether your blood pressure is being taken every 30 minutes, it should be, some of your responsibility. And if you're not, then again, you're adding, to the effectiveness. So she said a lot of great things. And wow, on point.
Jared, I wanted to ask you, you're a man of faith. You teach Bible study at your
yes,
church.
I do. Yes, I do.
What we're talking about tonight, this broadcast, the people responding, what's happening right now, how big does spirituality plays a part of this?
Spirituality is extremely important. I'm very, very adamant in thinking that everybody needs to have faith, okay? Because life in general is hard, okay? Life is going to hit you with so many different things. Like for me, okay, I've had my own father die of kidney cancer, and my mom died of breast cancer. And my dad in 1993 and my mom in 1999. And then I've been through a divorce, and I've had multiple things happen in my life. So, those are life events. Okay. And then you add on top of these life events, okay, if you add kidney disease on top of it, okay, that is going to intensify, all right, anxiety. It's going to intensify depression. Okay. So when you're already struggling just with your regular life events, because life is hard, and then you don't have faith, it's extremely difficult. Okay. And I am a big advocate, a big proponent that if you have your faith, okay, the spirituality can help you get through this. And then if you are in tune, okay, with God, because your faith is strong, then you can feel directed, guided, okay, by the Spirit to do certain things. God will look after you and God will give you direction. But if you're not following his influence, or if you're not following what he's asking you to do, then you may not be able to follow a certain path that he wants you to go down. It's extremely important to be spiritual. I'm telling you that if you want help, God will give it to you.
Mm-hmm. Yeah, and I just believe that everything happens in that and when it's supposed to. I'm more spiritual than religious, but you know, I think back, Jared, again, what we're talking about right now, safe dialysis care, is so important to many people who undergo outpatient kidney dialysis or home dialysis. And Jared, I don't know what would it be right now, this time, this moment, if we didn't meet, if I didn't have my accident at my job, if I didn't start Urban Kidney Alliance back in 2014, I wouldn't have never met you. I mean, I look at how the universe shifts.
Yeah.
And I don't just think everything, I mean, I think things happen for a reason, but I don't think they are coincidences.
No, I don't believe in coincidence.
All right.
Yeah.
I believe this moment that we're talking right now was already preordained before we even knew it. This broadcast, safe dial. You know, a year ago, I wasn't even thinking about doing this broadcast. Not even 2 days ago or three, well, before I posted, you know, the ads for it, that wasn't the furthest thought in my mind. And I say all that to say that this stuff comes through the Spirit, because I just don't sit around trying to come up with stuff. It just comes out of intuition. I call it God's Spirit within me.
Inspiration, sure.
Yeah, but this is stuff that needs to be talked about, that's not being talked about. And we just want to show people, when we post and ask for donations, we do it so we can pay for this broadcast, or we could pay for Warriors Quest broadcast and help the Brown Brothers production team who have graciously come out of their pocket and donated their time and energy to help many warriors that I can't even count on my fingers, to assist them with finding donors, seeking donors. And this stuff is not free. I mean, you know, it costs. I mean, we work, but we have families, and we use donations to help support the cause in this ministry, to continue to spread the word. Like I mentioned, help us, help you, help us. You know, and Jared, I mean, this is very important.
It's very important, and I totally agree with you, Steve, that, you know, if you felt inspired, and I think you were inspired to talk about this tonight, and because I don't believe in coincidences, then I feel like there's a reason why we're talking about it. There's a reason that maybe somebody, you know, not maybe, because I honestly feel as though if there is inspiration, then there is somebody who's going to watch this either tonight live or a replay tomorrow. Maybe we do a watch party and somebody watches it as a replay, and they watch it while they're having dialysis.
Absolutely, you hit it right. I was just about to say that. You read my mind.
Whatever the reason.
Tomorrow is Monday, and that's a
dialysis day.
That's a heavy day. That's a day. Monday, Wednesday, Friday.
Right. You know, and so there's a reason why we're doing this tonight. There's a reason why somebody needs to hear this. And so in order to have the right people hear it, okay, and get the message, we just need to share, okay? And then by doing that, you know, it's going to help the right person who needs to hear it have this information. Okay, we can be messengers, so to speak. All right, and if we all do this together, you know, we're much stronger when we unite, and we can get this message, and we can reach a lot greater audience when we do share. Versus if all of a sudden we just watch it tonight and we feel good, we feel inspired, okay, but then tomorrow, okay, all right, that was a great broadcast. But if it's not shared, okay, then that great broadcast, all right, doesn't continue to be a great broadcast to other people. It's so
Exactly.
so important that the people that aren't watching it today live, that they get a chance to watch it. Okay, it's very important that everybody has a chance to hear about what we're talking about.
Absolutely, Jed. That's very important. Very important. That's why I have mentioned in the past. If you have kidney disease, it's your moral obligation to share these broadcasts. So if you're fortunate enough to hear this or get information that may have helped you or assisted you or maybe lessened the anxiety of this process of dialysis, please share it so other people can get that same benefits from what we're doing. Knowledge is power. And then speaking of knowledge, I want to go over this short checklist by Barbara Grant out of Oakland, California. And this is just, it's not something that's been like handed over to units and say, go by this. But this, Jared, this gives warriors an idea of maybe what to look for, what to ask, or their family member, or what to observe at the dialysis unit. So everything below, which I'm about to discuss, or everything I'm about to discuss, describe the steps to what we call, or what's called, safe dialysis care. And this is a checklist, and maybe, you know, we could print this out or something, try to put it on PDF, maybe for $1 donation, you could download it and use it for yourself. Or if not, you better write it down right now. That's the only way you're going to hit, you know, get this again, unless we offer it as a $1 donation PDF. So number one, Jared, it says scale and pre-treatment. So you want to make sure, if you got a parent or even yourself, that, and this is not for everyone, okay, because everyone can get up on their own, but for people who may be in wheelchairs or older people, did a caregiver escort you from the lobby to the scale to check your weight? Jared, some technicians and nurses assume patients can walk on their own, or they may have a lot of bags or stuff in their pockets, and assume that they're going to weigh and they're going to take everything out and weigh correctly. And you know, that's just not the case with a lot of people.
Right.
And as a result of that, you get inaccurate weights when the patient comes to the chair, hand the weight to the caregiver. And that can lead to taking off either too much or too little, but the weight may be incorrect because maybe the patient didn't take out everything out of their pockets, or maybe they stood on the scale with their cane or with their walker and didn't remove it and just stand on the scale by themselves. Okay. B, caregivers gave assistance to patients who cannot walk on their own. That's what I was just talking about in the beginning, Jared. Some caregivers don't give assistance, man. Other patients help other patients into the units because the nature of the environment. Again, it goes back to what you were saying about the system. Okay, the system has it set up in these units where sometimes it doesn't allow the caregiver to go out there and get the patient because they're working on putting someone else on. Okay. So again, it goes back to maybe someone else assisting them or another patient. And then C, which falls under scale and pre-treatment checklist, caregivers made sure I removed all heavy clothing, bags, or other items before stepping on the scale. Jared, this happens a lot, especially if patients are miseducated or don't even know, especially if they knew and don't even know about taking stuff out of their pockets. Like their wallet, their cell phone, their keys, change.
Right.
All that adds weight when you're on the scale. And that's very important to analyze that, because when you're taking off fluid, man, you don't want to take too much off to have somebody be hypotensive, which means low blood pressure.
Yeah, I mean, we're talking about somebody's life. I mean, the margin of error, we need to minimize that as much as possible.
And Jared, number 2, checklist during treatment. A caregiver check my vital signs before beginning treatment. Jared, before treatment, patients are supposed to get their pre-weight, pre-BP standing, pre-BP sitting. Some places may just do a standing or just sitting, but you should do sitting and standing, pre-temperature, and pulse, Jared. You got to check your temperature to make sure the person doesn't have infection before the treatment, but you want to monitor what the temperature was pre-treatment and post to see, like, you may have a temperature of 98.6, which is considered normal pre-treatment, but when you get off, your pressure your temp may be 9. I got to check that, okay, to figure out, or the technician's supposed to come to me and let me know as a nurse so I can figure out what's going on. I recheck that. So if it's 101, not 101.9 post-treatment, what caused that person's temperature to go up from 98.6 pre-treatment to 101? So now you got to start doing your analysis. Do they have a catheter? If they do, is it drainage? Is it pus coming out? Did the technician check it when they changed the dressing to see if that occurred? Did they change it? If they have an access, is it swollen? Any redness? Is it warm to touch? And none of that is, do they have infection? If they're diabetic, if they have any open wounds. So you got to go through a plethora of stuff to kind of narrow it down, and then it may not be none of that. It could be a bloodstream infection that could be created from something else. So if you don't monitor that and you send the patient home with a 101 and they get home, you can, I mean, other stuff can happen. So that's why this pre and post vital signs are very important. Sometimes patients leave out and don't even get their post-temp because they in such a hurry to leave, or the technician may have taken somebody else off at the same time, which is not supposed to happen. But they may take somebody else off and gotten busy, and the other person, they didn't finish him up before they started someone else taking them off or putting them on. They've been waiting around for the person to come back to take the temperature or take a standing blood pressure. They just get tired and just pull off the cuff and just walk off.
Just walk off.
No, this is true. Right. And they may be so mad, depending on the personality of the person, they may be so mad that they may not even get to wait and just walk out the door and say, F it. I'm just being for real.
Right.
This is stuff that happens in a lot of units that's not talked about.
But it happens.
And that's why it's so important to make sure if you go to dialysis tomorrow morning, make sure you take your pre-weigh, which I know a lot of people do, but make sure they take your pressure standing, sitting, take your pulse rate, and the pulse rate and the pressures are normally monitored by the machine, and your temperature. And if you're on dialysis and your blood pressure takes and the pump and the pressure pumps up and it finishes and it alarms, or if it beeps, or make sure that pressure is taken. Because Jared, what happens a lot of times, patients may have their arm bent and the pressure's different.
Gotcha. Yeah.
No. It inflates and it deflates, and it doesn't take the pressure, and it will go on to the next half an hour, and it didn't take the, say if it's 7:30, if the patient has their arm bent where it's supposed to be extended, so because we're talking about a machine taking it automatically, so if the line is kinked or something like that, it's not going to get the pressure.
Gotcha.
It's going to time out. It's going to time
it
out,
won't even take
and
it.
it's going to move at 8 o'clock, and you didn't take 7:30, and then you got people pressing to take the 8 o'clock and write it in for 7:30, and then take another pressure and write it in for 8 o'clock. But that wasn't the original pressure at 7:30.
Wasn't accurate. Gotcha.
Exactly.
Yeah.
This happens, but as John mentioned, a lot of people don't realize it and don't think about it. And that's why we do these shows. That's why I'm on here now talking about it, because it happens so much that people don't realize it. And it may sound like a surprise coming from me or hearing it now, but mark my word, if you're on dialysis, this either happened to you or hasn't happened yet, but it can happen. It's the nature of the business. And then B, during treatment, patients were checked on regularly and patients' calls were quickly answered. Again, it goes back to the example of Barbara Grant, who created this checklist, who I told you, Jared, who soiled on herself because someone wasn't available to answer her calls quickly so she can go to the bathroom.
Right.
As a result, she soiled on herself. Okay. C, the clinic had the medication I needed to address treatment side effects. Jared, there's been many times I work with DaVita that they ran out of medication, that someone had to go to a sister unit to get the medicine, and we couldn't give a shift of medication to patients.
Wow.
Okay, because someone they made a mistake on the order. Again, human error.
And do you think that mistake can actually cause more mistakes because of that? It just kind of becomes like a domino effect.
It could, because say if a person didn't have a medication, and so the person's supposed to say if it's antibiotics. Okay, let's take that. Say if a person's supposed to get 6 treatments of antibiotics, the patient and say other patients getting antibiotics, and say the unit only has a box of 25 because they come in a 25 box, right? And say someone's not counting the medicine because you're supposed to do a medication count. And say someone, you got multiple nurses coming in and they just not keeping up with it, and you run out of antibiotics and a patient didn't get their dosage. And so that means they didn't get their dosage. Say they get 6 dosage and you gave them 3. So they're supposed to get a 4th dosage, but you missed it because the antibiotic wasn't there. And say it may not come, the patient had the next treatment didn't come. And say you had a PRN nurse that don't know and come in. And you see what I'm saying? So you're supposed to get 6 dosages, only got 3. Medication ran out. Medication could be in. a nurse could miss that patient didn't get the 4th dosage
and never got the
exactly
adequate amount of medication.
Exactly. That's happened many times, even with Benadryl. And Benadryl is one of the medications they use for side effects. If a person gets a medication that has maybe an anaphylactic reaction to the medication or to the dialyzer, we may administer Benadryl to it's an antihistamine to help minimize the symptoms of that medication or reaction that they may have had as a result. And then they go on for number 3 in the treatment, which is just one thing. They say, before removing needles from my access point, the nurse recheck my vitals. So that's very important, Jared, before pulling needles out, that warriors get their blood pressure checked, sitting and standing before they pull the needles, because a lot of times we may pull the needles out prematurely because it's the end of treatment, and then we may have taken too much off, and then the person can't leave because they try to stand up, and they may experience orthostatic hypertension or feel dizzy or nausea. And normally what happens, we took too much off, and we end up having to re-stick them and give them maybe 1,000 milliliters of saline or 500 until that pressure comes up. Are you there, Jared?
Okay. Yeah, I follow.
Yeah, you frozen on my end a little bit.
I'm following.
Yeah, so this is very important, and so that's the end of treatment that Barbara Grant recommends on this checklist. And I mean, I got it written down. I'm not reading from no paper. I mean, I'm reading from a paper, but I'm not reading from some sheet from another organization. This is something that I read. That's my handwriting right here. All right, and so I mean, this is how dedicated and serious we are in getting this information out there, Jared.
Very important. Since their kidney disease patients can actually get this information and benefit from, and I can't say enough how important it is that we share this and that we make sure that everybody has a chance to hear this and to have the same information so that it's understood. They're looking after themselves, and that they can see the care, that there is a checklist, and that they get a checklist, or that they write it down from what you're telling them, or they pay a $1 donation, whatever it might be. But this is invaluable. I mean, it's borderline priceless, because you can't put a price on life, and it's very important that everybody hears it.
And Jared, absolutely. And the thing is, Jared, because of the nature of this disease and the nature of dialysis and what goes on in center, you're not going to be able to get information like this from people who want to sit down. I mean, don't get me wrong now, you got techs and nurses who do educate, sit down and talk to people. Not everyone, but they may have their favorite patient that they want to talk to and get information. But again, everybody needs to hear this, not just 1 or 2, 3, 4 people. Everyone who undergoes kidney dialysis or their loved one, if you're a caregiver, you need to hear this too, so you would know how to properly respond if something happens. If your loved one come home and you see blood on his shirt or blood on his pants, you want to know what happened. Jared, that happens a lot too. People going home with blood stain because once they finish treatment, they started bleeding again because they been rushed out or hurtled out of the chair so the next person can get in. There's some people who right after treatment, they bleed. They move the chair out the way and put it to the corner and bring the next person in and start working on them and forget about the other person. Jared, it's ridiculous. And that's why people need to know what safe care dialysis is and not fall for the okie doke when you go into the clinic and not let them tell you anything. Be prepared. Write this checklist down if you heard it. If you didn't, we'll put it up in a future date on a PDF for $1 download. So you'll be able to get that information and walk to the unit being armed and ready to take on these guys. What do you think, Jared? Yeah, we got a little hesitation from Jared. Looks like we lost him on the broadcast. Jared is experiencing some internet connection issues. He's been experiencing that from the start of the show. He's all the way live from Hooper, Utah. So we've been on here for almost 2 hours. I'm about to shut this broadcast down, but please share this broadcast. Share. Continue to share our broadcast and all information. So, Jared, thanks for returning back. We're just about at the 2 hour mark. Very invaluable information we talked about tonight. What do you have to say to sum up everything we talked about?
I want to summarize and say that it's important to share this. It's important to make sure everybody has this checklist. It's important that we all make sure that if you are the kidney disease patient, that you do make sure you're getting the special care, that you're getting the care that you deserve. And if you're not and you're the caregiver, make sure that your loved one is getting the care that he or she needs at the dialysis center. There are variable reasons, okay? Steve was great at near the holidays trying to get people educated in regards to making sure that your time isn't shortened because of holidays. And there are so many variable reasons why maybe your care may be sacrificed a little bit because of this, that, or the other. Whatever it might be, make sure that you're taken seriously and that you're getting a complete dialysis, okay? Because your dialysis is supposed to make you feel better, and it needs to be done correctly. And so I'm so excited that we've done this show, but it's so much more exciting if we're able to get this out to more people. And so we just need everyone's help to make sure that this is communicated and that this message is given to more people. So thank you, Steve, for putting this information out there.
Thank you, Jared, for taking the time out of your busy schedule from the Brown Brothers production team to come on the show and
welcome.
Share some valuable insight on this much needed topic, safe dialysis care. What does it look like to you? And we hope everyone who watched this show got something from it. If they're not on dialysis, we hope you got something on it that you can share with someone that you may know that's on dialysis, or you have a loved one, or if you're on dialysis yourself. We hope this broadcast helped you in some form or another to deal with this ugly disease. So, Jared, with that, man, I thank you for coming on, and look forward to Warriors Quest this week. Who do you have on?
Yeah, we've got a kidney warrior that you're familiar with. I believe you've already I'm glad to bring her back on.
Who is that?
But the person I have on the schedule for this, can you hear me okay, brother?
Yes.
Yeah, so I've got Jody Lynn. Jody Lynn is going to be on Warriors Quest this Wednesday.
Great. All the way from Washington, the state of Washington, right?
That's right. Yeah, that's right. Yes. Yeah, she's all the way from the state of Washington.
I'll be sharing this story.
Yeah. So excited to be back. Had a little bit of a break. Haven't done Warriors Quest for a couple of weeks. We did Warriors Quest 2.0, of course, and I'm on tonight, but we'll be back on Warriors Quest Wednesday at 8:30, Eastern Standard Time. And we've got Jody Lynn from the state of Washington. I'm excited to tell her story again because she's been on your show, and it'll be great to give her a little bit more, Facebook Live and give her some more time to get her story heard.
Oh, absolutely, man. Can't wait. When you going to do another Warriors Quest 2.0?
Oh, as soon as possible, man. You know how I keep it 100.
Right. Okay, man. Well, can't wait to this Wednesday. What date is that? The 8th?
The 8th, yeah. It's hard to believe it's already nearing the 8th. The 8th is going to be this Wednesday, yeah.
All right, guys. You heard it from the man himself, Jared A. Brown, host of the new hit show Warriors Quest right here on Urban Health Outreach Media. Jared, thank you for coming on, man. Talk to you soon.
You're welcome. All right, peace. I'm out.
Take care. Guys, thank you for tuning in tonight. Again, this was an awesome show. We hope you got something out of it. And please continue to watch all broadcasts coming from Urban Health Outreach Media. Share all broadcasts, all PSAs. We got to get this story out there. We got to let mainstream. We got to bust the ceiling with this. So we need your help. We got to do it together. Just not one organization alone can do this, but we can do it together. So with that said, thank you. God bless you. If you go to treatment tomorrow, have a safe treatment. Remember what we talked about. And please stay blessed, stay encouraged, stay educated, be mindful. God bless you and have a good night. Peace.